Can I start by saying good afternoon to everybody and welcome to this afternoon's Birmingham Health and Wellbeing Board. It's on the 27th of July, 2021. I know we've started a bit later this afternoon, but I'd really like to welcome you all. Can I say that we are live streaming this meeting for subsequent broadcasting. So please just be careful what you say. We do allow you to take photographs or to accept if it's exempt items, but we are putting this on the YouTube site. Can those wishing to speak indicate using the chat function or by raising a hand, and only speak when you're called by myself, who I'm the chair of the meeting, Paulette Hamilton. And please switch off your mic and your video when you're not speaking. I will move swiftly on to item 2, appointments to the Health and Wellbeing Board, and the terms of reference. To note the reappointment of the board with the functions, the terms of reference, and the membership as outlined in the schedule. So can I ask you to check your agenda pack if you haven't already done so, and we are renewing the membership as highlighted in the notes. At this point, I'm going to ask Justin, did you want to say a few words, or are you happy for me to carry on?
Happy for you to continue, Councillor Hamilton.
Thank you. Can I do item 3, declaration of interest? Members are reminded that they must declare all relevant pecuniary and non-pecuniary interests arising from any business to be discussed at this meeting. If a disclosure of a pecuniary interest is declared, a member must not speak or take part in that agenda item, and any declarations will be recorded in the minutes of the meeting. Apologies. Can I go over to, I'm not sure, will that
be Errol today?
Is that Errol today? Errol, have you had any apologies for the meeting? Errol? Have I lost you? Errol Wilson, can you unmute, please? Right, have we had any apologies for this meeting, Errol?
Only those that I've indicated on your notes, Chair.
Oh, I haven't got them on my notes, Errol.
Oh, you haven't? Oh, I'm sorry.
There's something going wrong with my notes today,
well,
Errol.
There's none that have been sent through then, if that's the case, if they're not indicated on the list that I've sent through to you.
Okay, well, what I'll do is I've got a few people who have raised their hands. So can I go over to Karen Halliwell? Have you got apologies, Karen?
Yes, I have apologies from Paul Jennings today, so I'm attending on his behalf.
Okay, anybody else? I've got one apology, and that's Kate Booth, who sends her apologies, the Cabinet Member for Children's Services. She's just stepped down. Anybody else? No? We will move swiftly on. Right, now the dates of the next meeting. Now we have highlighted those in the notes, but just to make people aware, for the next municipal year, we have 4 meetings. We have decided that we will proceed with the 4 meetings, but we may have to extend them to 3 hours rather than 2 hours. So it will go on from 3 till 6 or 2 till 5. We will let you know nearer the date, but the meeting on Tuesday the 21st of September will be in person. It will be at that will be decided, but I think it will be the BMI building on Margaret Street. And then the meeting on the 30th of November will be an online meeting. Then the January and March meeting, you will get where those will be held confirmed at a later date. All meetings will commence at 3 o'clock. I've seen on my agenda, so I apologize for saying 2 o'clock. So all meetings will continue to commence at 3 o'clock. And then item 6, the minutes of the last meeting. I am asking the people in this room if they could note the minutes of the last meeting that was held on the 16th of March. Has anybody got anything they need to change, or can we record it as an accurate reflection of the last meeting? Is that agreed? Can
Agreed.
I proceed? Thank you, Justin. And I'm presuming silence means others also agree. So we will move on. Now, the action log is normally done by Stacey Gunther, but she's on holiday, the service lead. So today we will hand over to Aidan. Aidan All, in your capable hands, can you go through the action log? And yeah, we'll take it from there. Aidan, over to you.
There are no outstanding actions, Councillor Hamilton. Thank you.
Fantastic, thank you. We will move swiftly on to the chair's update. Now, I know that you all absolutely wait for these updates. This one is quite a long one, but I think it will be an interesting one. So let me just start by saying it's been a very, very busy month with lots of meetings and lots of events. And as the country is taken out of restrictions, as restrictions were lifted on the 19th of July, Birmingham has been identified by the government as requiring enhanced support due to increasing numbers of COVID cases. But I think that's been taken away from us. We have stepped back from the enhanced support now. We continue to encourage our staff to take twice weekly COVID tests and also following guidance around PPE and social distancing. It is also confirmed that on Friday, the 9th of July, that we are now experiencing wave 4 of COVID-19. And although it's looking as if the figures this week, it's looking quite good. Sorry, is that you, Justin? Sorry. There has been a slight decrease around the rapid rise in preceding weeks. And I know that our health colleagues will continue to battle with the pandemic in our hospitals as admissions rise. And I also do know that in our hospitals at the moment, intensive care is quite full, and so that most people are aware, the reports that are coming back to me as the chair is that the bulk of the people that are in intensive care at the moment, 3/4 of them, they've unfortunately not taken their vaccine, or they've only just had one vaccine. So can I say, as I say at every meeting, if you have got young people in your household, if you have not had the vaccine yourself, please go out and take that vaccine. And just to add that the national vaccine program has been expanded, and we all need to do what we can to increase uptake. And the more people who get vaccinated is the way out of this pandemic. It has been a busy few weeks, and last week I'm really sad about this, but Councillor Kate Booth resigned. She had already indicated that she would not stand as a councillor in the local elections, but following the recent SEND re-inspection, Councillor Kate Booth decided it was time for her to step aside and let someone else with a fresh approach to take the mantle as Cabinet Member for Children's Wellbeing. I would like to formally thank Kate Booth for her professionalism and support for the Health and Wellbeing Board. Kate didn't miss a Health and Wellbeing Board, and she was a key member of this board, and she played an active role in particularly championing the health and well-being of our city's children. And as a former school deputy ed teacher, Kate is committed to improving the outcomes of all our children, which she did magnificently in the role. And the leader of the council, Ian Ward, will be announcing later today the new cabinet member. At council earlier this month, the leader and I put a motion forward that was passed, which supports calls and pleas for bereaved families from the government to launch a fully independent public inquiry into the COVID pandemic. The pandemic has claimed too many lives, and we have all faced the loss of loved ones, and we have shed too many tears. We have supported family members and friends. We all have battled with the fallout of decisions taken nationally. But our next steps will be to write to the Prime Minister, Boris Johnson, to urge him to set a timetable for the inquiry, which will give bereaved families and us all, to be honest, the answers that we need. This pandemic has exposed the links between inequality experienced across race, gender, class, disability, age, and sexual orientation. It has highlighted existing inequalities in terms of low-income families, education, health, housing, but it's also revealed new divides in terms of our ability to work and learn from home, to access green spaces, and the extent of the digital and financial exclusion that's out there. Last Friday, I absolutely had the pleasure to chair a mental health challenge webinar. The mental health is a huge and growing issue, and the impact of over a year of social distancing and isolation is having a profound impact on the mental well-being of all our citizens. And although health services have remained fully open throughout the pandemic, the need for social distancing and isolating has seen an increase in the need to provide support via the phone and online platforms. I feel we have yet to realise the long-term impact on mental health, and we really need to understand the key priorities. I know that this has been a little controversial, but I am absolutely delighted that it has now been made official that after 6 years, Birmingham is coming home. So from April 2022, our health system will be co-terminus with the Birmingham boundary. The Minister of State for Health announced last week that West Birmingham would be leaving the Black Country system and we will welcome them back into the Birmingham and Solihull family, well, integrated care system, but I call it family because they never left really, next year. So on that positive note, and I have to say, I was delighted that finally came to pass. And on that positive note, can we move on to the next item? Because West Birmingham is definitely coming home. Thank you for that. So I'll move to the next item. Public questions. We've had no public questions this month. So there are no questions that need to be answered. So now, without further ado, I'm going to ask Dr. Justin Varney to give us the COVID-19 position statement as it stands at present. Justin, over to you. Thank you.
Thank you, Councillor Hamilton. And I'll be brief today, as we discussed in some detail last week at the Local Outbreak Engagement Board, the detail of what's going on across the city. Our case rate as of the 21st of July, which is the most recent validated data, was sitting at 524 cases per 100,000. And that was only a 6% increase compared to the previous week, which is a significant improvement. However, it is important to highlight that we have seen a reduction in testing since the closure of schools. Obviously, where children were going to school, they were testing regularly, and the highest case rates was in school-aged children. So as the schools have closed and children are not testing as highly, we have seen a reduction in the case rates. However, the overall percentage of tests that are positive has remained relatively stable, although the rate of increase in percentage positivity is slowing. So I think at the moment it is too early to be too positive, but what we are seeing is that the case rate is coming down because testing has reduced, but actually we are seeing signs that the percentage of tests that are positive is starting to come down as well, which is good news and does suggest that the vaccination programme is starting to bite in terms of the transmission. We know that vaccine is very effective at reducing hospitalisation and preventing people becoming seriously unwell or dying. We are seeing some evidence emerging that it is also good at preventing long COVID. And sadly, we still see many people of younger ages as well as adults coming through with long COVID symptoms. And what we're also seeing evidence of is in the double vaccinated, although people can catch COVID, they don't tend to get sick with it and they don't tend to be as good as transmitting it. So in households where people are vaccinated, there is something like a 30 to 40% reduction in the transmission in that household. So again, another reason to have the vaccine is it's showing it is reducing that transmission. We have seen some changes in the case rates across the city. Particularly notable has been the case rise in recent weeks in the Sutton Coldfield constituency. Those case rates are starting to come down, and we think that that is very much a reflection of some of our more affluent areas where people haven't previously been going to work, now going back to work as some of the offices reopen, mixing more through socialisation, and the impact of some of the spread through children and then into households. We continue to work proactively with the NHS to respond to both the needs of patients who are sick with COVID, to encourage testing of all adults twice a week, and we should continue that even if we're vaccinated at the moment. Still keep testing twice a week, particularly if you're going to go somewhere that socialising, you're going to the cinema, you're going to a club. Lateral flow before you go is the kind of key phrase. Do that lateral flow test and just check that you haven't got COVID and you aren't going to spread it around to the people that you care about, because you never know if one of them might not be vaccinated. So lateral flow before you go. Vaccination uptake is continuing. We obviously have a very large hill to climb in terms of the younger age group of Birmingham. We have more young people than anyone else. And just looking at the most recent data across Birmingham and across both the CCGs, we're up to 64.5% of all over 18s have had their first dose, and over 50% have had their second dose, which is a fantastic achievement and down to the hard work of the NHS. However, we still have 340,000 people who haven't had their first dose, and just under half of those are aged 18 to 29. So we still have a significant hill to climb, and we really need to encourage young people to get the vaccine, to get dosed, because we know increasingly the evidence is debunking any of the fake news and the myths in social media. It's showing the vaccines are safe, but more importantly, it's showing that the vaccines do protect against some of the long-term ramifications of COVID, like long COVID, that do affect young people and seem to affect young people almost as much as they affect older adults. So yet more reasons to go and grab a jab. And if I coin the Black Country for this, it's don't go round the Wrekin, go grab a jab, Bab, because now's the time to get vaccinated. Happy to take any questions on the update, but as I said, there's more detail on the Local Outbreak Engagement Board, part of CMIS.
Any questions? I haven't seen any hands up. Have you seen any, Justin? Okay, well, Justin, as per usual, excellent presentation, quite concise, to the point. So what we'll do is we'll move up. Don't go around the Wrekin, go grab a jab, Bab. I like that. I like that a lot. Okay.
See, I'm going native.
You're going native, are you, Justin? Okay, on that note, what we will do, Justin, can I thank you for that? And we'll move swiftly on to Carol Aliwell, and then I'll bring Dr. Aslam in. I hope he's here. I can't see him anywhere, but I will bring you in after to just give the West Birmingham side of things, Dr. Aslam. So Karen, over to you. And it's good to see you, Karen.
Yes, and you. Thank you very much. I won't go through the figures that that Justin has gone through, but as we've heard, the main challenge is the lower age ranges than the over 18. And I'm really pleased to say we've had some great partnership working at community level. I'd like to thank all the local councillors for their support in really getting that engagement working really well. There's still a lot more to do. We have mobile units, we've got pop-up clinics, we have a variety of different communication routes, social media influencers, digital platforms. So we are learning and we are trying lots and lots of different ways to try and get people to have their vaccinations. So I think we are not going to let anybody falter in terms of their need for a jab, and we will continue that programme of work. I think the other thing to acknowledge is we're now also planning for phase 3 for the booster programme and for the flu later this year in September. So we're just in the process of modelling that at the moment. And there will be some areas where we'll co-administrate those, the flu and the COVID jab together, particularly hopefully for care homes and those at home. But obviously we have to look at the wider supply processes for flu just to make sure they align. They're very different in terms of how they are delivered. So that's a big piece of work at the moment. And obviously the other thing to note is we've had some guidance around children's vaccination, particularly those with underlying health needs. And we are waiting for further guidance as well. So a lot of planning, but also continuing that work to try and get the overall vaccination rate up. So that's just a very quick summary, Councillor Hamilton, of where we're at the moment.
Right, thank you for that, Karen. Are there any questions for Karen? Right, Karen, I don't want you to go away because I'll see what people say once we've heard from Dr. Aslam. Dr. Aslam, over to you.
Hi, Councillor. I'm equally excited about the Secretary of State's announcement as well. So we never left, as you know. So
no.
Clearly, if we're coming home, we're coming home.
You know, I've got my T-shirt. You're coming home.
So just from a COVID perspective, I think, you know, last week we had 13 people in intensive care beds. We've got 27 this week. We've got 145 beds occupied. There were 126 last week. The COVID infection rates are high in our community, which makes it very difficult to run COVID-free services when there's so much COVID around. So although we endeavour to do that as much as we can, having very high infection rates makes that extremely difficult. So it is a difficult time. We don't, in general practice, we are continuing to operate a triage first system, as is indicated to us from NHS England, that the operating model we should apply. Our estates don't accommodate lots of people in one go. We can't afford to have vaccinated and unvaccinated people in the same facility for a short period of time, just in case the risk of giving COVID to unvaccinated people and the risks associated with that. So it is difficult. We're working through it. I think we are managing. Our demand in general practice is around 50% more than it was pre-pandemic, and so the strain on services, not only for us but in walk-in centres and accident emergency and on admissions, is high. So this is a difficult time, and summer sometimes is a time for respite. It's not for us at the moment. As Karen said, we continue to plan for the vaccination programme for the winter, for the boosters. The difficulty that we have is first of all, we've given no advice on whether we can administer both together. There are some situations where we have been given advice, but creating a model where we deliver probably 500,000 vaccines in a short space of time. We cover most of the population, including children in the flu vaccination programme, and that's all children, is going to be a challenge. I think I saw our community services, Richard Beek, was it Richard? I see somebody on here anyway, from the Community Healthcare Trust. And I think a large part of that work is going to fall on their shoulders, because actually we would expect a large portion of the flu vaccines to be delivered at schools. So I think there is planning for us to do together to make sure that this works. We've unfortunately heard from NHS England today that the pharmacies that we've gone through an authorisation process to deliver COVID and flu will have to go through another authorisation process to deliver in September, which I'm hoping they will unpick, because the level of bureaucracy to increase the capacity to deliver vaccines in our community is well, it needs to be balanced. But overall, I think we're making some progress, Councillor. So so COVID rates are high, demand on services is high, our vaccination rates aren't as high as we would like, but we're working on it. And all of the things Karen said about the councillors being involved and communities being involved is really important, because actually our obligation is to make sure people can have a vaccine. I think it's up to communities to convince themselves to go and get jabbed.
I absolutely agree with both of you. Now, the question, I've just got one question that I'd like to ask. You've done both West Birmingham and across Birmingham and Solihull. We have done a really good job in trying to get people along and try to have as many sites as possible accessible, and tried our best to promote it. But the question I want to ask, are we still doing elective work, and are the doors of the hospital, this is just for the purpose of the record, are the doors of the hospital still open, and are people still being welcomed in with the types of numbers that you've been talking about, especially Dr. Aslam?
So I can speak from Samuel and West Birmingham's perspective. So yes, the doors are still open. We're continuing to do elective work. There will be delays because every bed that's occupied by a COVID patient could be occupied by somebody from an elective care perspective. Every intensive care bed stops us doing an operation that might require somebody being in intensive care, but we are working through that. So we have continued to do our elective work. The challenge for us is that there is a backlog that is going to be difficult to manage, and we need to really be realistic about the time frames for that. Mm-hmm. And the balance of that really is more occupied beds means less place to do elective work, and I think that as we move through this peak, and I hope that this is coming to an end of this peak, hopefully, then we'll try to get back onto steaming ahead with our elective work, but it is a challenge.
Yeah. Now, the question I wanted to ask Karen was about, you said you've started preparing for the autumn for the flu vaccine and the other stuff, the COVID-19 virus. No. The COVID-19 vaccination, I've had a hard day. The COVID-19 vaccination, Where are you with that at the moment? When are you going to start being ready to start calling people in and getting down that road?
Where we're at the moment is looking at, particularly on the flu, the modelling from the national requirements that we understand around the supply. This is something we do every year for flu, but particularly this year, getting that modelling right and understanding, as Dr. Aslam said, how we can combine them together is going to be really important. So we're in the modelling stage at the moment. I think timescales that we understand are around September. So obviously it is getting the assurance around the pharmacy sites, whether they're assured and ready, and also discussions with GP practices and other sites that we have sufficient capacity to deliver. So very much working on the here and now to deliver the current vaccines, but also working really hard on that planning stage. So it's matching that supply and demand at the moment, just to make sure we're ready.
Right. So my last point, and then I will shut up if there's no one else asking any questions. It is around every year what we've done, because we do work closely with the health service. We have had shortages. We've had shortages of supplies, especially of the flu vaccine. And normally, you guys actually order your following year's supply from February. So have you actually got enough supplies, or is there extra there waiting? So when you start this program, there will not be a problem with supplies.
So I don't think Karen or I could give a guarantee on that. I think we struggle not only with total volume of vaccine, but the supply chain on a year-to-year basis. So we will plan. You're exactly right. We order in February, March based on the next year's numbers. We are never allowed to order as much as we need. So we always and pharmacies will often order an amount that they think that they will need and receive it before we do. So there is always a challenge around where people get their flu vaccination. Am I convinced that the total number will be there? I'm convinced that the government will have that on their agenda to make sure that we have enough vaccine to vaccinate everybody that they've asked us to vaccinate for flu. So we are able to do that. Can we give assurance? I don't. Karen might be able to. I personally have not had the experience whether they've delivered on exactly what they said they would deliver on.
So the last, unless Karen wants to add to it.
I'm just saying, I think there's an awful lot of learning and that we've done through this period about how to really work through that modelling. But I agree with Dr. Aslam, there is no guarantee that we will understand that supply chain on the flu until nearer the time. But I think what we are doing is working an awful lot closer with the centre around understanding that supply chain and when it's coming. So we are pushing really hard this year, I think, to make it as seamless as possible, but we can't guarantee.
And if through the Health and Wellbeing Board we can support that with anything, as we did last year, I'm hoping that even if it was only a little bit, what we did help. Please let us know, because that's what we're here for, to help each other. So go on, Doctor.
I think that is important, isn't it? Because like the point that I made about the bureaucracy of authorizing a pharmacy and then having for them to go through an authorization process again is difficult and unnecessary. So I think a consensus view of make the bureaucracy as light as possible so we can get on with doing our jobs, I think, is a sensible approach. So if we do come across challenges, it may be that we come to you to help unpick them.
Yeah, that would be really, as you know, I'm always happy to help through the council. So if we can support in any way, bring some of these arguments to government. Not sure what they will do, but at least they'll add weight to what you guys are saying. So just let us know, and the offer is there. Okay.
One last thing, Councillor. The other thing that's been specified is only using NHS estates. And I think that is also going to be a challenge. So it would be again useful if we work together to use some of the local authority estates potentially to understand whether they could be vaccine delivery partners.
can I bring Justin in at this time? Justin, have you been having any discussions in this area? Because I can't see why that would be a problem. But have you started any discussions?
Yeah. So
Yeah.
there are discussions between the NHS and the council about venues for vaccination, potential sites. We're also helping them to identify commercial premises that can be purchased, because there is funding the NHS has to cover any rental costs. And I was particularly signposting towards perhaps some of our banqueting suites, which are less busy in the winter, but are actually well placed in some of the communities where access is more of a challenge. So one of the officers in the council is working with the NHS proactively on this. I think that I think, as both colleagues have highlighted, one of the challenges we have is that the public announcements and the guidelines and what the NHS professionals need to enact things are not quite matching up, shall we say, at the moment. And we know that both in the COVID vaccination programme and in the flu planning, there is quite a lot of protocol process documentation that we require, particularly in relation to children and the extension of children, that needs to be in place before we can start it. And I do want to just add on this point, I know the government made some announcements about children and COVID vaccination towards the middle of last week. That will come into effect towards the end of August, because we are waiting for those clinical documents to be provided by national colleagues, and without them it's difficult for our local clinicians to act. So just in case we've got any parents watching who are concerned or anxious about that, we are working on it as fast as possible, but until we get some of those national tools that we need, we can plan for eventualities, but it would be much better to get those set out clearly so we all know what's happening.
That's really, really good. And thank you for that, Dr. Varney. Thank you, Dr. Aslam. And Karen, as always, thank you so much for your briefing. We'll move swiftly on now, unless there are any questions. And I haven't seen any hands up, so I'm going to move on. The next item is the JSNA deep dive by Luke Islop, the service lead, and it's around veterans. So Luke, can you come in, please?
Thank you,
Luke.
Hamilton. Okay, so thank you. Hello, everybody. I'm Luke Islop from Birmingham Council's Public Health team. I'm here to talk to you about the findings from the JSNA Deep Dive Programme's Health and Wellbeing of Veterans report, which has reviewed the available evidence and engaged with the voice of Birmingham's veterans through focus group interviewing. Armed Forces service is different to other occupations in the general population due to the unique factors that personnel and their families experience. These can include increased risk of physical injuries and death, mental health problems relating to their experiences in service, and also extend to the difficulties relating to frequent moves, subsequent adjustments to civilian life, including housing, employment and finance. And although the government believes that the majority of veterans adjust well to ex-service life, there is growing evidence that a significant minority of veterans struggle to adjust to civilian life and then subsequently experience health inequalities throughout their ex-service lives. So the main finding of our report is that there is currently insufficient data to allow a full understanding of the size and therefore the needs of the local veteran population in Birmingham. This is due to lack of identification in the routine data. For example, veterans can only currently be identified through the routine data if they self-identify at their GP surgeries, which often doesn't happen due to stigma or fails to be recorded properly by staff. So GPs therefore need to be more proactive in identifying veterans within their practice population. The Royal College of General Practitioners is working with NHS England to accredit GP practices as veteran friendly. Accreditation requires GP practices to accurately code armed forces veterans within their patient lists, and also to provide a clinical lead within their practice who should undergo dedicated training, stay up to date with the latest research, and ensure that the practice is meeting the health commitments of the Armed Forces Covenant. There are currently 20 GP practices who have achieved this accreditation within Birmingham, so work is needed by the integrated care system to encourage the remaining GP practices to also join this scheme and to monitor their progress. In association with this, all health and care professionals should be made aware of Birmingham's Armed Forces Community Covenant from 2012 and should understand their duties arising from it. And a refresh of the covenant, taking into account this report's findings and also introducing a performance measure, is also recommended. The 2021 census for the first time has included an armed forces service question, and this will allow cross-sectional demographic data about Birmingham's veteran population, which can subsequently be used as a target for veteran identification to reach within the city. And increased veteran identification will therefore allow the health needs of the veteran population in the city to be understood more clearly and allow for the planning and delivery of health services. These would include establishing a more proactive and preventative approach to veteran mental health issues, navigating people towards accessing support much sooner and earlier in the process. And additionally, there is mounting evidence in the literature for increased mental health and suicide risk among young veterans, early service leavers and female veterans. So we recommend qualitative work aimed at understanding the specific needs of these minority groups and providing action to understand and mitigate the barriers and inequalities that they face. Naturally, we are looking for partners at the moment. We're currently looking widely to find partners to take these measures forward. Thank you, Councillor Hamilton, and I'd be pleased to take any questions either here or on email.
I'm just putting my lights back on. Dr. Will Taylor wanted to make a point and ask a question. So Will, you've got the first, you're on, if you could.
Yeah, so thanks, Councillor Hamilton. Yeah, I had a long chat and email exchange with Justin earlier. I mean, it's quite obvious from the report there are things that we could do as commissioners and especially around general practice and primary care to make this better, actually. And it's really encouraging that a number of practices have become veteran friendly with the RCGP scheme. But we could really do something to encourage more and actually make more aware that it even exists. I've had a look at what it is, and it's not a difficult thing for practices to do, but it would really make an impact for veterans in the city, I think, if more practices did that. So certainly that's something we can champion as a CCG. And I think the other thing is really just trying to improve that data. You know, if we're proactive at recording people who are veterans and encouraging people to self-report that they're veterans, we can then help flag them and prioritise them within the system. So that's something I think we need to go away and discuss about how best to do.
Okay, thank you for that. And can we ask, Mark Garrick to come in, please? Or Garrick, have I got that right?
Thank you, Paulette. Yeah, Mark Garrick, thank you. The UHB Director of Strategy and Client Development and the acute provider. So thanks, Luke. I really read the report with a lot of interest. And yeah, very similar to what Will has pointed out in relation to the lack of published data. It was just to identify and provide some support. So just to make you aware that UHB still does host the Royal Centre for Defence Medicine, and so there might be some data sets there that might be useful in relation to the data elements. And then from a social responsibility perspective as well, I recognised in the report that there was some things around employment, and it was just to say that UHB has successfully become a Step Into Health Employer Recognition Scheme Silver Award winner, and I think yesterday we received a letter to say that we're a Gold Award winner. So also would like to get involved from that perspective for other organisations if it's helpful in driving this agenda forward for you.
That sounds very helpful, thank you.
Right, and I just sorry, I'm trying to do two things at once, which is never a positive thing. But I just, Justin's going to come in. Justin, if you come in next, I'll have the last word. Justin, over to you.
Thank you, Councillor Hamilton. So two things I'd say. Firstly, thank you very much for the positive feedback on the report. I was really pleased with the way that the team worked to engage veterans' voice and working with the voluntary and community sector of the city, who know our veterans often best, and have worked with them to enable their voice to be heard through the report and to make sure that the recommendations really resonated with their experiences of our services. So I'm very grateful for that. I also want to acknowledge the hard work that Luke particularly put in. He came to us during COVID. He picked up this piece of work that unfortunately the team that had been leading had to be redeployed into COVID, and has helped see it through to completion. And given the year that we have been through with COVID, the fact that we are now finally able to publish this through the board, I think, is huge testament. But we also have a commitment then to ensure that this work is taken forward. And I hope that we are able to bring back to the next board an update from partners, a written update from partners on what's been done to take forward some of these recommendations.
Right, thank you for that, Justin. Sorry. Right. I just want to say that our veterans are truly important to us, and they deserve the best possible treatment that they can have. And I really found this report really helpful to help join the gaps. So for myself, I welcome this report. And again, I didn't, this report is long overdue, and for me, it's a good piece of work, and it's something that Luke has done a really good job with, and he's done it with love, if that makes sense. You can see where the care really went into it. So I am really impressed with it. As a board, I'm trying to find, I'm ever so sorry, but I am going to have to ask. I'm really struggling today, Errol, because I haven't got the outcomes, the recommendations. So I'm trying to go through the long document as well as the short document. So can you tell me, Errol, what the recommendations are that we are agreeing to today? Thank you. Errol, you've got to come off mute.
I'll pick this up and come straight back to you, Chair.
Yeah, so we need
to... Councillor Hamilton, shall I just step in on this one?
Yeah, because we normally have the recommendations on my brief, but it's not there today. So are we agreeing to just accept this report?
Yes, so the ask of the board is to accept the report. And I've said we will, as I've said, we will update on the recommendations and progress being made at a future board. So we continue to make sure that these reports mean something.
Yeah, so it's recommendation. What is the recommendation? 3.1 to 3.
Yes, so the recommendation is to recommendation is 1. For
the numbers, I just
1.1.
Yeah.
To receive the report. Right.
Can I ask the board to accept the recommendations as written in the full document, 1.1 to 1.2?
Received.
I haven't anything. Received. Agreed. Thank you, Stephen. I'm really sorry. I'm not sure what's gone wrong today, but the minutes I've got is slightly they're not as good as they normally are. Right. The next one is creating a mentally healthy city. Justin, do you want to go before this one or after?
I'm happy to go after this one, actually. Okay. We're doing well on time.
All right. So the next one is creating a mentally healthy city forum, and Natalie Stewart is going to give us a brief overview on that, on what we've been doing at the Mentally Healthy City Forum. Natalie, over to you.
Hello, Councillor Hamilton. Hello, everyone. So I'm here to talk through the highlight report, which is attached to your papers. The Mentally Healthy City Forum focuses on upstream prevention and improving mental wellness across the city. The forum last met on the 17th of June, and this was the first time since June 2020 due to COVID-based activities. The forum meetings have been scheduled for the rest of the year, and we now have themes attached to those meetings as well. Whilst the forum itself has been on hold, various projects have been progressed, and what I'm going to talk around will provide updates to the board as requested on the terms of reference, the prevention concordat, peer mentoring and mental health champions, the Better Mental Health Fund, and suicide prevention.
What's the name?
The terms of reference has been in place since 2019 and is now due to be refreshed after being in place for 2 years. It will expire in September 2021, and a draft document will be ready in time for the next forum meeting, which is scheduled for the 19th of August. The Chair and Director of Public Health will be asked to review and feedback, after which it will be presented to the forum membership for their comments. New members are currently being nominated to fill any gaps left by original members due to changes in job roles and organisations over the pandemic period. The Prevention Concordat for Better Mental Health was due to be signed in 2020, but this has been delayed due to the lockdown and having to step down the forum due to other COVID-related priorities. The Concordat was relaunched in December 2020 to include the effect of COVID-19 on good mental health and well-being, and seeks to find the actions that will be put in place as we work alongside our community and partner organisations to reduce inequalities and mental health issues across the life course. It also seeks to find out how we prioritise and engage with the most vulnerable citizens in our city for better physical and mental health. The Concordat has now been drafted and reviewed by Public Health England as part of the new process, and the document revised in accordance with their feedback. It's already been sent off to the Director of Public Health and the Chair of the Creating a Mentally Healthy City Forum for their comments, after which it will be presented to forum members. We are aiming to achieve commitment level on application to Public Health England. The Peer Mentoring and Mental Health Champions is a joint initiative between Public Health, Children and Young People team and the Mental Health team. Progress has been made on the design of this project that will support children and young people on building good mental health and well-being. We are working with Birmingham Education Partnership, and through their support, we have a focus group made up of volunteers who work in mental health, children and young people services, education, an educational psychologist, young people with lived experience, service providers for children's services, academics and community workers. We are about to use the feedback to write a draft specification and will be sending to the focus group for their feedback. Another meeting is in the pipeline, and we are hoping to commission this service by August 2020. The Better Mental Health Fund. The Public Health Division's People team leads on the mental health and well-being agenda. And recognising the many and varied drives on mental health and well-being, we developed a broad delivery plan outlining action to address mental health and well-being inequalities in the city. So this programme of projects has been selected based on the lasting legacy that they can provide in Birmingham. And I'd just like to touch on a few of those projects, if that's okay. So they're all evidence-based and built upon established work programmes that focus on skills development and resource development, and where there is clear evidence of need. So 11 projects were approved, including mental wellbeing support for women with multiple complex needs. This intervention is targeted at women aged 35 to 50 years with multiple complex needs. Current service users include those within the criminal justice system, victims of domestic abuse, rape, sexual exploitation, substance misuse, and the intervention is based in one of Birmingham's most deprived wards with a large Bangladeshi population. The intervention comprises training on regulating emotions and dealing with distress and seeking safety. It would develop digital content and translated training and support resources, and will offer a series of events such as coffee mornings and walking groups. This will be provided by Anna Wynne Birmingham Centre for Women, and I'm pleased to report this is now being signed off by our legal, finance and procurement teams, and we are now in the process of sorting out their offer letter and contract. Bereavement support. Local evidence has found that take-up of existing universal bereavement support has been lowest within our most deprived areas and in our Central and Eastern European communities, Black communities and the LGBT community. This intervention will increase the reach and equity of access of this service by introducing outreach work in schools in the most deprived areas of Birmingham, training 20 bereavement volunteers and providing targeted and culturally specific support, outreach and resources. Mindful Muslims Programme. This intervention offers peer-to-peer bereavement support specifically for the Muslim community, facilitated by a qualified and registered counsellor, ensuring emotional safeguarding, as well as hosting a series of seminars to increase awareness and confidence on issues surrounding mental health. The Being Well programme. Mental health and wellbeing training will be targeted at people aged 18 plus who have mild to moderate mental health issues or those at risk of developing mental health issues. This intervention will deliver 15 courses aiming to improve resilience, mental health and wellbeing, enhance participation in community life, and getting back to the post-COVID new normal. Youth Mental Health Peer Support Programme. Using personal experiences to support youth mental health peer support workers will enable and increase access to mental health services in the 0 to 25-year age group, reduce stigma around mental health and associated barriers to existing care. This intervention has been developed with the service users and has wider partnership support. The peer support workers are all former users of mental health services. The Creating a Mentally Healthy City Forum will oversee the delivery of the programme, and we will of course report back into the Health and Wellbeing Board. Suicide prevention. The last suicide prevention advisory group took place on the 10th of June for the first time again since June 2020. And forum meetings were placed on hold due to the need for public health to focus resources on the various activities being taken against COVID-19 in Birmingham. Collaborative cross-sector working is evident, with a number of service providers and stakeholders swapping details so they can find new ways in which to work together to ensure services are provided consistently and as widely as possible. The action plan now mirrors the Health and Social Care Overview and Scrutiny Committee progress report. And despite the ongoing pandemic, good progress is being made against actions, with most being either in progress or achieved. We are now working on moving the Year 2 actions forward, with plans underway to ensure progress is achieved, and some of the bids received as part of the Better Mental Health Fund will help toward this. To further ensure delivery against the action plan, we have worked collaboratively with the Zero Suicide Alliance and the Learning and Development Service for Birmingham, and we are hosting the Zero Suicide Basic Awareness Training module. Some of the key messages in the training are that suicide is everyone's business. Talking about suicide does not give anyone the idea. For many, it is about ending pain rather than dying, and it's important to take all talk about suicide seriously. We have ensured that we will be able to collate demographic details of who across Birmingham and Solihull will be accessing the awareness training, which will provide us with a picture of what's happening in real time and whether our key high-risk groups are changing. It will also allow us to spot any trends coming up and actively monitor the need for training across different sectors and communities of interest. In addition, we are pleased to share that suicide bereavement training, post-vention support for staff and organisational response is available as well. This training is all about suicide bereavement and how to support an individual. It covers helpful and unhelpful language, signposting, and understanding how suicide bereavement can be very complex. It also details how bereavement by suicide can affect family, friends, and colleagues in different ways. It aims to provide learners with the skills to talk confidently and give appropriate support to adults affected by suicide. through various scenarios. This course should take up to an hour to complete, and the training can be found on the Mind Ed website. Thank you.
For that. Thank you so much. Natalie, you know, I think you do a wonderful job, especially around the suicide stuff, which is so very important in Birmingham, and which will be going to full council when? When will it be going to full council, Natalie?
I don't know, but I do have a meeting with you to discuss it on the 7th of September. So we do have a date in the diary.
It's going. Okay, so Douglas Simkis, over to you. First question.
Thank you. I'm a paediatrician and the medical director in the Community Trust, and it was within the Better Mental Health Fund. You described a series of projects, and I'm taking notes as I go along, and I might have got confused. Was one of the bereavement projects around bereaved children?
Sorry, let me just refer back to my notes, if that's okay. We do have a lot of, we have 11 projects being funded, and
just in CTS. And so, because there is a kind of workshops in schools. Okay, so if I just explain why I'm thinking about it, we've got a palliative care nursing team in the Community Trust, and we have now 2 consultants who work with families, one between the Community Trust and the Children's Hospital, the second between Acorns and the Children's Hospital. And it's just a question of whether linking that service to this initiative would be of value to families. That was the question.
And just to add to that, before I bring Justin in, I have to be honest with you. The question I'd written down after listening to you do this presentation again, how are these projects going to be linked with other parts of the NHS, people like Healthwatch and people like BVSC? How will they be linked together so it's not just seen as something being done in isolation? So that was my question. Justin, over to you.
Thank you, Councillor Hamilton. So yes, the way the bids were developed is we did it with the membership of the Creating Mentally Healthy Forum, in which the NHS is represented, the Mental Health Trust are represented. I think, Doug, there was a member from the Women and Children's Charitable Foundation was part of the discussion. So and the delivery of this grant and its programs will link back through that forum, which is multi-agency. BCVS are represented as well. So all of the partners are represented. And I do want to just pay credit to the to Natalie and the team, who worked incredibly hard. We had about a 2-week window from when the fund was announced to when we had to put in a fully costed partnership bid with every single project costed up with a delivery plan. I mean, it was a huge amount of effort. And what was fantastic was how partners worked together. So we were very upfront about, we only have a year's money. We've got to have an exit strategy. We've got to be clear it can deliver, and we can't fund everything. And actually went through really rapid joint prioritization. Much of that was also talking through how does it connect with existing services. You know, how do we make sure that this isn't a kind of one-hit wonder and that we actually really connect through? And some of the things that changed through that process, for example, was the project that Birmingham Education Partnership are leading, working with primary schools on creating mentally healthy schools. That originally their ambition was to do all schools, and there was no way that could be delivered in the time frame of the grant or the money. So they reprofiled it down to focus on, I think it's 25 primary schools in our most deprived wards that have been hit hardest by COVID. So I think there's been some really good collaboration about that. And a lot of that has been, how does it interdigitate and interconnect? But Doug, we will pick up offline how we can make sure the psychology support, which I think is coming through educational psychology services, is connecting across with your new palliative care capacity, because it'd be a really good bridge to build, not just for this, but actually in the long term as well. I think the more we can link those services up, the better.
And Justin or Natalie, I sort of know the answer. I do know the answer, but I'm going to ask it. How are we linking up things like the community trust with some of this really good work that you guys have done? And I know that I chair the Mentally Healthy City Board, so I should know the answer, but I do think the question needs to be asked. How are we ensuring that we evaluate this as we go along to ensure that our organizations are not just working in isolation and they are doing the joined up piece?
So we have Mentally Healthy City Board in August. The programme will report into that board, and we'll continue that. I think the Community Trust is represented. They certainly were previously, but I know with Salma Yaqub is changing roles. We need to double check that all the right trusts and that the NHS partners are connecting with the other partners. Obviously, with the number of hospitals we have and acute trusts and other trusts in the city, we can't have everyone at the table all the time. So we are reliant on NHS partners to also link across with others on this to help us. But Birmingham Forward Steps I'm trying to remember what the other one is called. I get the children's and the mental health one, they're always the wrong way around. Forward Thinking Birmingham, there we go. They both got forward in it, that's why. Both of them connect into this through different partners. So I think we are confident we've got the partnership right, and the forum is the space, and we'll continue to update through the forum. If any of the partners feel that they would like more representation in the forums, please talk to us. We know that over the last year, we've really seen the academics of the city start to engage more from different universities. So we're getting more academic engagement, and similarly from our NHS partners. And as the ICS forms, that's another good opportunity for the ICS to really formally engage in that space. Just on the point of evaluation, this is part of a national grant programme, and there is a national evaluation framework, and Nat and the team are having to get their heads round. I think we've had, is it two seminars in the last week, and certainly about 6 emails with the metrics. So there are nationally standardized metrics, and what the team are now doing is taking the metrics, and it's like a smorgasbord of metrics, and then working out which metric works for which intervention, because it's not all the metrics for every intervention. So if you're doing an intervention which is, so for example, group therapy, there's a slightly different intervention from metric from if you're doing a whole school approach to mentally well-being. So they're just working through how they match those up, but they've been nationally provided, and we have to nationally report on them. I think, Nat, it's monthly, or it might be, yeah, monthly, she's nodding on them. So there's quite tight evaluation around this, actually. And that's part of government being really keen that this money builds the evidence base, because actually the evidence base of what works is still quite limited when it comes to children and young people's mental health, and also adults. This isn't a life course programme. And we were commended on our bid for the breadth of diversity that we had, but also the strength of the clear way we articulated what we wanted to do and why we wanted to do it and how we were working with partners on it.
Yeah, because that's my big thing. It's no good us doing a wonderful piece of work in the City Council if none of the partners know about it or are involved. Stephen, over to you. You'll have the last question on this one, or point.
So this relates to the ICS and the ICP. So primarily in Birmingham, the ICP has been an adaptation of the Birmingham Older People's Programme, but it would be useful from a governance perspective if both mental health and the children's work could be thought about being aligned more concretely. I just wondered whether there were any plans to take that up going forward. It might be for Justin and perhaps Karen as well.
I can tell you where I sit on all of this. At the moment, the discussions are being had. Nothing's firm, nothing's finalised, and nothing is off the table. But at this moment in time, the chief exec and others are having the discussions about what sits where and what will the structure look like in Birmingham. It's very much down to that governance piece. What is it that we want this system to look like? The government has left it quite fluid. The way that the paperwork has been put together. It means that as it goes through the committee stage of government, local authorities are and the health service are very much being allowed to put this together. So at this moment in time, I don't want anyone to commit to anything because they are absolutely in discussions. And Justin, over to you.
Great, thanks, Councillor Hampton. Yeah, and I agree. As you said, things are still very much up in the air, and we continue to work with ICS colleagues. It is important to stress the ICS is across Birmingham and Solihull, and then there is place level working at the level of Birmingham and at the level of Solihull, and we are working with them on that place platform being the Health and Wellbeing Board, because we're all around the table and we don't need another meeting to go to. And therefore, naturally, there are some subcommittees that already exist, like Creating a Mentally Healthy City, but there are some that don't. And you know, there has to be a discussion about the children's transformation work and where that sits. The other piece that's still evolving in the ICS is what's called the provider collaboratives, and that's the partnership of NHS providers at the hospitals, the community trust, the mental health trust, etc., and how they're going to be configured. So I think there's still, as you say, Councillor Hampton, quite a lot up in the air. But I think we are all committed to making sure, one, balls don't get dropped because no one's holding them. So working out what happens and where does it go, but also being clear about there are some things where we've got to be Birmingham based, and some even where we've got to be smaller than Birmingham based. We've got to go to localities or wards. Yeah, there are tiers in Birmingham, and then there are things that need to be Solihull based, because Solihull's a different kettle of fish and a very different population. And actually, there are times when it makes sense to work together and times where it makes sense to work apart. And the mental health work is a really good example of this. Actually, you know, much of what we're doing through this grant is Birmingham based. The suicide prevention work, we are collaborating with Solihull and with the wider West Midlands on things like real-time surveillance, where it needs to fit a police footprint rather than a local authority footprint. So I think we've got a good track record of working through what's going to work for Birmingham. And I think our NHS colleagues are very, very minded and sighted on this and navigating what is an interesting journey between now and the beginning of April next year, when the ICSs come into full force.
Thank you, Justin. Can I go straight over to Richard, and then Karen Halliwell will have the last word. Richard Kirby and then Karen Halliwell. Thank you.
Thank you.
Richard, good afternoon.
Thank you, Councillor Hamilton. I was going to say a lot of what Justin said, but just to add a couple of pieces to the jigsaw. Of course, for children in Birmingham, the Birmingham Children's Partnership, I think, kind of is a clear kind of strategic leading partnership, and there's work going on to make sure that's got an effective operational delivery arm. And there are colleagues here from the Mental Health Trust who could, if you want, say a bit more about the relationship around mental health services being developed between Forward Thinking Birmingham as the children's child and adolescent mental health services and the adult mental health services in Birmingham and Solihull. So I think it will come together. It's perhaps the short thing to say, but there's obviously a number of pieces of the jigsaw to fit in. We'll fit them well over the next few months, I'm sure. I'll probably leave it there.
Yep, I think you've said that really well. And the last person, Karen Halliwell.
Thank you, and I won't prolong it because it's probably along the same lines, but just to say, you know, it's really important to join all the dots up and to build on the strengths we have in partnership, but actually to ensure we've got very clear lines of accountability. So I think everybody knows David Melbourne. He's the programme director for the ICS, and he's very keen to engage around all these areas. So there are, as you say, Councillor Hampton, plenty of opportunities to work it through together.
Yeah. Thank you. That's a good place to end. Justin, you haven't put your hand down. Did you want to say something else, or have you finished?
No, I finished.
Okay, Justin, bless you. Thank you. Right. On that note, Natalie, did you want to say anything else, or can I move to recommendations?
Happy to move to recommendations.
Okay, well, it's recommendation 3.1, and is that agreed?
Agreed.
Right, so Yeah, does anybody wish to abstain? Can I just ask you just to put agreed in the chat box? I don't normally do that, but I'm not happy with how I'm chairing today's meeting, so it's good to have things done correctly. Right, we're going to move swiftly on. Justin, do you want to go next?
Yes, good. Yes.
Yes, if I could, please, Councillor Hamilton.
So we're going to swap 16 with 15. So we're going straight into 16, creating a healthier city framework. And Dr. Justin Varney will be presenting this one. Justin, over to you.
Thank you, Councillor Hamilton. This is a short written report which I hope members have been able to read, which just sets out the progress we've been making on the Creating a Healthy City Framework document since the last board meeting. And as you can see, we've taken the pre-consultation draft to the forums to really focus in on their sections. We've been using the tool of Mentimeter to allow for voting in those forums, which I think has been a really successful way of helping to capture people's views about prioritisation. And also that's helped to shape where they feel that there were still gaps and things that we should strengthen further. So in terms of the next steps, we'll be bringing a final draft to board members in the next week or so, which will allow members to have any final input before we move forward into the consultation phase in September, dependent on approval from Cabinet. So the board is asked to, and I'm just getting the exact wording of the recommendations up, note the outcomes from the sub-forum consultations and asked to continue to support the direction of travel towards finalising the consultation draft ready for September. And I'm happy to take any questions from the board on that.
I apologize. I can't see anyone with their hand up. So we will move to the recommendation. So it's recommendation 3.1 to 3.2. Is that agreed, or does anybody not agree or wish to abstain? Can I ask you again to just put that today in the chat box for me, just so I know exactly what we're dealing with? Okay, that's fantastic. Thank you, Justin. I know you've got to leave the meeting for a few minutes and then you'll pop back, but can we move swiftly on to Balvinda Tang and Carl Beath, who will be discussing Public Health Commissioned Adult Services. Carl and Balvinda, over to you. Or Bav, over to you.
Thank you, Councillor Hamilton. Do you want me to go first, Bav?
Yeah, if you want to go, yeah, Councillor Hamilton, it is Bav. It's very simple.
Okay, I didn't want to get it.
Yeah, so yeah, if you go in order of report, Carl, if you go first and then I'll do my bits.
Yeah, so it's just a brief overview of the update report that's been provided to the board that was quite comprehensive. My elements are sexual health and substance misuse. So the board's already had sight of that document, and we made it comprehensive because there's been a lot going on during COVID. So I don't intend to go through it all word for word. I just thought I'd focus on a couple of key points for each area, and then obviously take any questions from the board. So in terms of sexual health, in summary, whilst the way in which Umbrella have delivered the sexual health service throughout COVID and up to present now towards the end of July, the service has been delivered throughout COVID, pretty much as business as usual, but with obviously a reduction in face-to-face appointments, but that's been mitigated against by offering video consultations, more telephone triage, telephone consultations, etc., and face-to-face appointments where absolutely necessary. In terms of Umbrella and where they are now, they enacted phase 3 of their recovery plan on the 1st of June. That's progressed well and all clinics are open. So at present, pending further government guidance, the business is operating as it was pre-March 2020. Another thing we've done with sexual health is, and the board have been advised of, is we've proposed a 7.5-month contract extension to the contract to mitigate against delays in commencing the sexual health needs assessment for Birmingham and Solihull, and that was primarily due to the public health team supporting the COVID response, hence a delay in starting work on that needs assessment. And the needs assessment drives everything that we do from a re-procurement process in terms of influencing our strategy, our service specification, etc. So it's a crucial piece of work, but I'm glad to say that work's commenced, and the final needs assessment will be with us in mid-August time, and that will be followed by the development of the sexual health strategy for Birmingham and Solihull, and then that will go out to the required necessary public consultation. So that was it in terms of sexual health. In terms of substance use, again, this is the adult services delivered by Change Grow Live, known as CGL. And as with Umbrella, whilst the way in which CGL have delivered the service has changed slightly during COVID to take into account social distancing, reducing face-to-face appointments, etc. It has pretty much been business as usual. And throughout COVID, the 4 CGL locality hubs across all 4 corners of the city have still been open for face-to-face appointments when required for new starts to treatment and for all medical reviews. And probably the most important thing to say on substance use is, and it's covered on page 12 of the update report, is the draft 000 city strategy on the city's plan for the next 10 years regarding substance use and the vision. That's out to public consultation on Be Heard as we speak, and closes at midnight on Monday, the 2nd of August. So I'd encourage you all, if you haven't completed that Be Heard survey, it takes about 20 to 30 minutes to complete, that if you haven't completed it, please complete it, because we want as many views from as many people as possible regarding that. And please feel free to share with any networks, colleagues, etc., because we're having one big final push in this last week before that consultation closes, so we can get a good breadth of responses, and then we can fine-tune that strategy as necessary. So that was it from me regarding sexual health and substance use. Councillor Hamilton, do you want to put it out to any questions before we go to that?
We haven't got any questions, so let's go straight across to Bav, and people may be thinking of a question and just haven't gotten around to it. So if I leave you to just relax for a bit, Carl, I will then go over to Bav. Bav, over to you.
Thank you.
Thank you, Councillor Hamilton. So if I start with health checks, so a very brief overview. I won't bore you with the history because I think everybody knows what the health check programme is. Mandated service to be delivered by local authorities. So the actual health check programme is to support prevention of cardiovascular disease. And in Birmingham, we have over 25% mortalities which are related to cardiovascular disease. So cardiovascular disease, I'll refer to it as CVD. CVD accounts for the largest part of health inequalities, which has actually increased due to the COVID pandemic. And those with cardiovascular disease are more likely to suffer the adverse consequences of getting COVID as well during this time. So things like diabetes, heart condition, high blood pressure, and so on. So it's very important we have this programme, and it's equitable and accessible by everyone. It's a 5-year programme, so the current 5-year programme ends in March 23, where the aim is to invite 20% of our eligible cohort, and at least half of those are invited in to complete a health check. So the current data shows that due to COVID, we did have a dip in a delivery, but because it's 5 years, it's not actually that bad because we were overperforming prior to COVID. In terms of invites, we're still above our target year to date for the current 5-year programme, and we've only lost out on about 2,300 health checks. The team are constantly working with GP practices, because the current model is delivered via GP practices, and every GP practice in Birmingham delivers it due to equitable access. So we're working with them at the moment. The current quarterly data shows that GP activity has started. So we normally have a target of approximately a benchmark target of approximately 6,500. And this quarter alone, we've delivered from previous quarter an additional 1,500 health checks. So we've done 5,100 health checks. So we're going to continue working with GP practices to ensure that by March 23, we've met our target over the 5-year programme. So in terms of future procurement intentions, next year we'll start looking at the actual package of offer we've got for Birmingham. And at the moment, the most equitable way to deliver the service is through GP practices. Obviously, with the development of the ICS, we'll see how that maps out with service delivery. And it's more than likely that we'll go down the route that we've used before for as a single contract negotiation, and again, another 5-year contract. And that's all dependent on whether PHE extend or the government announce the health check programme as a 5-year programme, or it becomes more targeted. But I'll keep the Health and Wellbeing Board updated on that. Quickly moving on to smoking cessation. So every year, Birmingham has over 4,500 people who die of smoking related diseases. So 1 in 4 of all, it represents 1 in 4 attributable to cancer, 1 in 5 deaths relating to CVD being developed as part of smoking habits, and 1 in 3 of all deaths from respiratory disease. And again, because of COVID, there was a campaign, Quit for COVID, which has actually given a bit more of a drive as to the importance of quitting smoking. So in Birmingham, they're saying the adult population represents and the prevalence is about 14% of adults currently smoke. And the core elements of service provision is behavioural support and pharmacotherapy. And in the pharmacotherapy, we include NRT and e-cigarettes, which is provided, and the service is currently provided via GP practices and pharmacy. The reason we're providing by GP and pharmacies is so that, again, we can map by ward, look at where the highest prevalence is and make sure there's a service available there. And we have been trialling out, which has actually been pretty good over the COVID period, a vape shop which has been approved by PHE as an approved provider. So they provide nicotine and e-cigarettes, and they've currently got an online offer, or during COVID they had an online offer, and they had a large number of people accessing their services when GP practices and pharmacies had a reduction in service provision. In addition to that,
can I ask you to round up, please?
Yeah.
Because
In addition to that, we've got Quit with Bella, which is an online app. Quits wise, I was expecting there to be a drop in quits, but we've actually got an increase. So we've actually performed better during the COVID period than the previous year, and that's thanks to the online and online provision and Quit with Bella. And again, future commissioning intentions, again, we'll be looking at commissioning via a single contract negotiation.
Brilliant, you two, brilliant. I'm really glad Douglas put his hand up, because I was going to ask himself, and I'll just prepare him, Richard, and I'm going to ask Carly Jones, how have they been involved, if at all, with any of this work? So let me start with Douglas. Douglas, over to you.
Well, thank you. I certainly met Carl. I had a sort of just a question for Carl around the interface we talked about a few weeks ago, which was between this service and the paediatric sexual assault service, which is now run by Mountain Healthcare. There's a small group of children, isn't there, that we identified that might slip between the gap in needing treatment, and it's whether that's been resolved, was the question for Carl. And then it's more of a just a linking for Bav, if that's the because the NHS has been putting forward smoking cessation projects through NHS England into acute trust. So it's not my community trust, but both City and Sandwell and the UHB hospitals will have a large amount of money and innovative practice about identifying smokers. It's currently a live project and will go on for 2 or 3 years. And it's a case whether that links to the smoking cessation service you're describing, because there will be a drive to identify smokers, you know, when they present to hospitals, whether that's a link that's working for you. Right, that's brilliant, Douglas. Before you answer, guys, Richard from the Community Trust, Richard Kirby, is anything going on? Oh, William, I was going to bring you in last, so don't worry, you're coming from the GP perspective. So Richard, over to you, and then it's Carly. Please get ready, Carly, then William.
Thank you. Thank you. I mean, as Carl and Bav have made clear, I mean, we're not the direct provider of this range of services, but our staff working with people on our caseloads should be identifying people who would benefit from these range of preventative services and making the right referrals and making the right connections, using the sort of making every contact count model. I mean, I'm really happy to kind of double check within our teams that that's still working as we think it is, and to pick up with Justin if we think there are areas where the connections.
Would you mind, Richard, because with what we've gone through with COVID-19, my concern, as you can see, I'm on a theme this afternoon, is that some of the linkages are being cut because people have been so geared into the emergency stuff, and some of the things that people don't see as important, even though it's really important, it's been the linkages are being cut. Can I move swiftly on, and thank you for that, Richard, to Carly. Carly, you run a brilliant service out. Well, it's over to you, Carly. Have you got any points you want to make?
Thank you, Councillor Hamilton. Yeah, we've been quite involved in some of this work, actually. Carl's team's coming to see us, or have been to see us, about the 000 consultation. So there's been involvement from clients because we talked about being able to have that sort of client voice coming through, and they don't always find it easy to access the Be Heard system. And obviously, I think a lot of effort was made as well in terms of developing that consultation process for the 000 strategy to make it more accessible, I think, for our kind of client group. So we've been quite involved in that piece of work. Also on the sexual health side as well, because Cypher Fireside was a contracted organisation with Umbrella, and the review of how those services are working, because we found that how it worked for us as an organisation in terms of meeting sexual health needs for the homeless population was very vastly different, and it was really positive actually to be involved in that needs assessment that's been going on recently. And again, we've been able to involve our clients in feeding back through that process. I mean, I guess where we would welcome a little bit more ability to input might be around some of the smoking cessation work, because just on our workforce side as well as on our client side, I mean, as we all know, within homelessness, it's disproportionate in terms of the number of homeless individuals that smoke, but also within our workforce as well. So just to give you a feel for that, I would say about 70% of our workforce are smokers. So it's a massive variant on what our averages are in terms of city population. And I suspect that's probably similar across other workforces in this sort of field as well. So just a comment really to park there. But yeah, we have been quite involved in a few areas of this work, which has been really welcome and positive. So thank you.
Thank you, Carly. Thanks for that. Will, over to you. And just so that everybody knows, if you don't know already, Will is my vice chair on the board, and he does an excellent job. He's my silent partner, as my husband is. So I'll leave it there. Will, over to you.
Really just a question to both now, and an offer of support, really, because I was really good to hear that you're getting increased uptake of the NHS health checks, and obviously smoking cessation, which is vital for our sort of public health. And going through general practice is the vehicle for a lot of that to get equity. But I do know that previously there's been variation, and quite marked variation, between practices activity, hasn't there? And I just wonder whether A, if you've got information on this, and also B, whether we as a CCG have got quite a good relationship with general practice across the city. So of course, any support we could offer in terms of just helping with that. And the other thing that's just occurred to me that actually now general practices are arranging themselves into PCNs to give, mutual support and things. Actually, some of this may be something we could look at through a PCN lens actually, and see how we could actually do it in a more robust way at PCN level. So it just occurs to me that.
Will, can I say that's actually an excellent point. Can I ask Bav and Carl to round off? Can I thank the speakers who have fed into this debate? You have got 1 minute to just round things up and for me to then approve the report. Thank you.
Yeah, if I go first, just responding first to Douglas's question around under 13s and SARC, that work's still progressing, Douglas, purely because of the number of key partners involved, but that is progressing, and I think it's a wider conversation that needs to be had with the ICS, with mental health, etc. So that work's progressing and will be included in our strategy, Douglas, and subsequently in our service specification. So we will get there. In terms of Richard, I can send you links, Richard, to all of the Public Health Commission services with basic details of how to refer, web links, etc., that you can share with all staff. We've done a similar thing with every team in adult social care, really helpful. So smoking health checks, sexual health, substance use, the wellbeing service. So I can get all those over to you tomorrow, Richard, and thanks, Carly, for the update on how positive the consultation experience has been regarding sexual health and substance use. Really good, and really glad for all of your teams and service users' involvement.
Right, and Bav, you're on mute, Bav.
Sorry, Councillor Hamilton. Just very quickly, then I'll just round up the 3 points. So Douglas, with the acute settings, we did try to make headway prior to COVID, but then COVID hit and that's sort of been a sideline. So we will be restarting that work again for robust pathways into community services. In terms of smoking and homelessness and linking in with Carly, I'll make sure Rachel, my smoking lead, links in. And just so that everyone's aware, during the COVID period, when homeless individuals who were homeless were housed in hotels, we did actually provide a harm reduction initiative where we provided e-cigarettes and stuff like that while they were staying in their accommodation and monitoring those. And activity between practices, William, yes, we do have that data, so we know who's performing well, who's not performing well. And we did used to keep in touch with Karen Middlemass, who has now left BSOL. So I'll link in with you so that we can get some support via yourself or an individual. And with the PCN lens, yes, that's already on the radar. I want to reduce a number of contracts I've got, because at the moment I've got 169 contracts. If I reduce that down to PCN level contracts, it makes our job easier.
Fantastic. Can I thank you both for a brilliant report, and let's move swiftly on to the recommendations to accept this report as presented. Recommendations 3.1 to 3.3. Is that agreed? Are there any abstentions, or is there anyone who doesn't agree? Can I ask you, for the sake of this meeting, to stick it in the commentary box, and we will move swiftly on. Now I'm going to go across to Deborah Brooks. Now, Deborah, I'm sorry, we're a few minutes late getting to your report.
Don't worry.
You'll be doing just a feedback from the Ofsted report that was done on children's services. So you'll be presenting the item. So Deborah, it's over to you. And we just really want you to skim over the top headlines, really. Yeah. And yeah, over to you.
Yeah, thank you, Councillor Hamilton. So just a really brief introduction. The report I'm referring to is the Ofsted and CQC local area SEND inspection. The original inspection took place in 2018, and in normal times what happens is that Ofsted and CQC return after 2 years to assess progress of the local area.
Because of COVID, ours was 3 years after the original inspection, and so it's a slightly longer period, and they have taken into account the fact that COVID happened during that period. But obviously, that we're no different from any other authority. So whilst they've made some allowances, it's only sort of it hasn't really impacted on the final findings. So the local area inspection, as it says, is an inspection of all the partners. So health, the trust, and the city council, looking at the way that we've discharged our duties to provide services to children and young people with special educational needs. In the original 2018 report, Birmingham was found to have 13 areas of significant weakness. And in the follow-up that's 3 years later, it was found that in only one of those areas, so 1 out of the 13, had sufficient progress been made. So obviously it was disappointing, although not wholly surprising, because one of the things that the inspectors did note is that their findings were fairly aligned with the self-assessment that was conducted by the partners that we submitted to them. So we were aware that it was likely to not be positive as we might have liked. So the report is publicly available now. It's been published for a number of weeks, and you may have seen that there was press around it. It was picked up mostly by local press, and that we've responded. The partners have responded collectively to fully accept the findings and to apologise, because I think it's one of the things that's really clear from the report is that the inspectors felt that the lived experience of children and young people was poor, and so we've fully accepted that is unacceptable, and that an enormous amount needs to be done now to turn that around. Following that, we have been notified by DFE and NHS England that they are minded to issue a statutory direction, which means that they will write to us formally and notify us of next steps, which is likely to be the appointment of a commissioner to oversee improvement work, and we will need to submit what they call an accelerated programme plan, which gives details of how we will ensure that progress is made sufficiently swiftly this time and monitored, and that we are on top of whether what we're doing is having the right impact, because obviously it's not sufficient to just do a lot of things. We need to make sure that those are the right things and that those are having impact, and in particular what we're prioritising in our response is what I referred to. So whilst it's really important that we get the strategy right and that we think about the long-term delivery of SEND in the city, what's, to be honest, the most important is that we act now to ensure that the children and families who are moving through the system now, who are being educated in our schools or in some cases not being educated, are quickly given the support that they need in order to achieve their full potential. So that's where our initial efforts are focusing on, making sure that our services are good enough, and that's absolutely the priority. And as a group of partners across the city, we'll be coming together to work on developing a SEND improvement plan. And I think what the other thing that I'd like to say that we really prioritise is we haven't got co-production right. Our Parent and Carer Forum have told us that, parents have told us that, schools have told us that. So as we move forward to relaunch a new improvement programme, it will have co-production at the heart of it. And that's why we haven't gone off and written one and published it straight away, because we're mindful of the fact that we want to involve families, children and young people, schools and our voluntary sector partners in that. So we will be initiating a programme of engagement from the start of the autumn term. So I think if I pause there and take questions, that's probably enough, isn't it?
Yeah, you may not get any questions. Has anybody got any questions? Because for me, I just wanted it highlighted to the board, because what I'm asking you to do, to take back to Kevin, is that for the next 3 health and wellbeing boards, we'd like you to be a regular fixture on the board, where you're presenting back what is happening, and the board can actually just do what we've done in the last report. I think it's unfair to do that today, but we just wanted to hear where you were at, and as a board, I'd like it kept on the agenda for at least the next 2 to 3 meetings, so at least we know exactly what's happening in that area. Is that okay with you?
Yeah, no, absolutely. That we welcome the conversation. Thank you. Councillor.
Okay, that would be brilliant. So on that note, I haven't seen any questions, so I won't push it because we have run out of time anyway. So Deborah, I'd like to thank you for coming this afternoon and for just feeding back what's happening thus far. But we will be inviting you to the next ones, and on that one, you'll be further up the agenda where we will have the opportunity to ask you questions. Now, item, thank you, and we'll move swiftly on. You have had some information items in the pack. Item 18 to 22. Those are all written updates, which I'm hoping you've all read, because to be honest, they're actually quite interesting. And if you haven't had the opportunity to read all of them, although they're all really good, can I please ask you to read the stuff on the updates on the Black Year and the ICS Inequalities Board, because they are particularly good documents, so please read it. Now, number 23, is there any other business? Nope. If there's no other business, the time and date of the next meeting is the 21st of September, and it will be at 3 p.m. I'm pretty sure that that meeting will be, it won't finish till about 5:30, but we will let you know with plenty of time. And that meeting will be a face-to-face meeting because we do have a number of decisions that we do need to take in persons. And because the legislation has now changed, we cannot do meetings that we have to actually take decisions. We cannot do that online. We have to be physically in the meeting. So the next meeting on the 21st of July, 21st of September will be an in-person meeting at the, I think it will be the BMI building at Margaret Street, but we will let you know closer to the time. Or if one of our partners has a boardroom or anything that they'd like us to use, I'm quite happy to go around, but it's if we're able to record it, because it is a council meeting that we do need to ensure we can record. So on that note, can I say have a brilliant evening, enjoy whatever else you're doing tonight. The weather is beyond awful out there, so if you're going outside, I really don't envy you, but enjoy the rest of the evening, and thank you very much for coming today. Enjoy the rest of the summer, and